medical professionals, what is the craziest DIY treatment you've seen a patient attempt? So, sugar can be used to help heal certain types of wounds. A patient I saw had missed an appointment with part of their care team where they got their bandage changed. I noticed what appeared around the edges of the bandage, asked my patient about it, and offered to change it for them. We didn't typically do that in our clinic. They said yes, though. So I go get fresh bandages and whatnot, take the old one off, and it's just sticky and stringy. Picture these slow-mo shots of caramel being pulled apart like that. And it smells. To be fair, most wounds smell, but this one was different. I finally asked them what they used to change their bandage since I knew it wasn't discharge. Maple syrup? They use maple syrup. So to answer some common questions, yes, honey, certain varieties, can be used with wound healing, so it's possible they confused it with this, but I don't believe that's what happened here. I can't disclose more because HEPA, the thing that doesn't seem to exist on shows like Grey's. No, I'm not sure it was pure maple. They said it was the good stuff in a glass jar, but who knows? Either way, it wasn't sterile and this wasn't a simple wound. Proper sugar dressings can be used on various types of wounds, but it's not just pouring some table sugar on it, so don't go trying this at home, folks. Necessary disclaimer. No, it wasn't Thousand Island dressing. There is medical grade honey. Studies show that it and medical grade sugar can actually be better for some wounds than antibiotics. No, I could not eat pancakes for a while. Honey dressings typically are less painful to administer than sugar because of the lack of crystallization, but that also means the sugar is better at cleansing. Your wound care specialist can determine which is the better route. Since this seems to be an issue now, no, HEPA isn't just saying the patient's name, it can also be saying enough that could then cause them to be identified. Up to this point, I have not revealed anything that would link this story to this patient. Revealing more to the backstory would, in my opinion. Considering I do not want to out this person as a human being or cause a willful HEPA violation as a now former professional, I won't go into the backstory, even with details changed as some have requested. I had to find the exact wording, but this is directly from HEPA. The term individually identifiable health information means any information, including demographic information collected from an individual that, with respect to which there is a reasonable basis to believe that the information can be used to identify the individual. I prefer to err on the side of caution with that. All right. Funny stuff, though. Also, because earlier today, I was reading an essay from a nurse who worked in rural China, and she was describing how she had to use sugar and honey to help heal her client's bed sores. Story 2. As a brand new nurse starting my career in a small southern hospital, I had a patient who was admitted to my unit with sort of non-specific complaints about a wound on her chest. She was a direct admit, meaning that she was sent directly to the unit from a doctor's office rather than going through the emergency room. When someone is directly admitted, I don't get a full report. All I can see are lab results and notes from previous doctor's visits. Basically, I'm flying blind. As I'm getting her settled into her room, I start asking a few background questions that will help me direct my assessment. So I see that you were admitted because you have a wound. Did you have an accident? Oh, no, it just kinda showed up. How long ago? Oh, it's been a while now, maybe a few years. Oh, okay. Well, if you've had it for years, what brought you in today? Has something changed? Is the wound draining, changing color? Well, it fell off. What did? My chest? So I help her get settled in the bed and move her shirt to take a look. The entire portion below her udder had totally eroded away. She explained that she'd been putting triple antibiotic cream on it and had started wrapping it in a baby diaper when it developed an odor. I kept my face very still, tried not to be visibly horrified, and listened to her talk about how she wanted to show it to her doctor at her yearly physicals, but for the last 2 years, her female doctor had been out of the office on the day of her exams. So she didn't feel comfortable showing her chesties to a male doctor, so she let it go. I nod, excuse myself from the room, and basically fly down the hall to the hospitalist's office. I tell him that he needs to call his female NP down to this patient's room immediately because she's old and scared and won't show you her chest, but it is falling off and no part of nursing school taught me how to make this better. It took them all of 5 minutes to diagnose her with a very advanced fungating breast tumor. She was totally unsurprised and said that she figured it was something like cancer. She placed herself on hospice and passed away less than 2 weeks later. Story 3. I got a boil in my armpit about 10 years ago. I'd never had one before and had just moved out of home, so I didn't know what to do. I was sort of hoping it would go away. After a week or two of strategic ignoring, it did not go away and was about the size of a golf ball. Every time I moved my arm, it would rub and hurt like hell. I had heard that doctors lance them, so I decided to give that a go. I had a nice, blunt, rusty pocket knife, so I tried to jab it in the shower. Like most people, I'd never jabbed myself before. I wouldn't recommend it. It's very hard, especially since it hurts so damn much. It hurts just to touch it, so you can imagine how much fun it was to poke it with a knife. I gave up and went to the doctor. By now, it was the size of a tennis ball, and I needed to have a wad of toilet paper in my armpit so it wouldn't leave stuff all over my shirt. The doctor didn't look too concerned, but when I laid down and showed him, he visibly recoiled and jumped back about a meter or two. He braced himself, lanced it properly, and I am mighty glad I couldn't see what I could feel dribbling into the stainless steel pan. This was followed by the most intense pain I have ever felt in my entire life, as he cleaned it out and jammed it full of alcohol-soaked gauze. Honestly, it was like someone was holding a blowtorch under my armpit and I had to bite my hand to not scream like a little girl. I've had maybe 1 to 2 boils since then, but you better believe as soon as I see the first sign of one, my old car is setting land speed records on the way to the pharmacy for some sweet, sweet antibiotics. If I were him, I would have just let that scream out. He earned that scream. Size of a friggin' tennis ball. Holy moly. Story 4. I have a weird one. A patient was told by her doctor that she had low magnesium and should consider supplements. Not uncommon. Instead of getting magnesium supplements, though, she ate an entire tub of, quote, homeopathic volcanic ash and completely destroyed her electrolyte imbalance and ended up in ICU. We admitted her as a pharmaceutical excess, so poison control automatically follows up with you. It was hard to explain to them. It was probably naturopathic, not homeopathic. I don't know enough about specific differences. Think of a tub of protein powder, but volcanic ash. Her husband brought it in for the poison control report. You were supposed to mix a scoop in with water for health benefits. She ate the whole tub and had a seizure and wrecked her kidneys. The activated charcoal/volcanic ash spew that was all over her when she came from emergency was a witch to clean up. Story 5. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was well-mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she'd been seen by every single digestive disease MD in our hospital system. Not only that, she'd had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy. You're opened up to basically look inside you when you have no clue what's going on. And all of this because for years she had one single complaint. She reported severe gnawing pain in her stomach. At this point, I should mention that she was speaking Spanish only. Not only that she had a very heavy Dominican accent, and I was the first Hispanic doctor to ever see her. My first language is Spanish, and even I had difficulty understanding her. So she comes in, and after exchanging some first-time pleasantries, I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again and asked for the cream to end it. At this point, I got intrigued. Her medication list only mentioned a cream used for breakthroughs. The previous fellow only mentioned in his note that in every single visit she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly told me she intended to stick the cream behind in order to end the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed that after eating a whole quail egg, the bird had spawned inside her and gnawed away whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic-type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had part-time jobs. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her now for 3 years, and she's happy as one can be considering she has a bird living inside her. So yeah, lady complains of pain in her belly. The worst case of loss in translation ensues, gets very invasive medical procedures, and turns out she's just a little cuckoo. Alright, man, so this one kind of made me sad. I'm really curious as to how or even if her delusions affected other aspects of her life. On a lighter note, it's good to hear she's doing a lot better, as one can be considering there is a bird living inside them. It's a hard left, but also don't forget to hit that like and subscribe button to my channel. It helps keep me going and it helps keep these stories going. Here's the next story. It's story 6. During third year med school, I was on a neonatology rotation, lots of premature babies or high-risk births. We get code green page for us for please come to delivery room as able and code pink page for please come to delivery room stat. There was a pager that was the standard one that got paged for this, and usually it was whichever of us med students who was on call carrying it. Our job was then to get one of the nurse practitioners and possibly a second nurse, and head over with the incubator, etc. to take the baby and get him or her to the NICU. About 6 p.m. one evening, as we're doing handover rounds, that pager goes off with a code pink. Then the neonatologist's personal pager. The next 10 minutes are a bit of a scramble and not particularly interesting from the point of view I had, as I was assigned to send pages to additional people and fetch things, but in short, a teenage lady of local Aboriginal descent had come in suffering from very premature labor. I want to say 20 weeks, but could have been 22 or so. She and her ex-boyfriend had recently gotten back together. He had discovered she was pregnant. Believing that the baby was not his, he attempted to terminate the baby. She did not want said termination, so he attempted while she was asleep. Baby and mother survived. Relationship did not. Later testing showed the baby was indeed his, for those wondering. Story 7. Vet student here. We once had a family that came in when their dog ate a bag of Easter chocolate. We had to induce spewing up, but first asked if they had tried anything at home. They said they read online to make the dog eat a bunch of salt to make it throw up. Now, this poor dog had a bag of salt repeatedly poured down its throat before he came in. Pro tip, if your dog ever eats chocolate and you panic, have him ingest about 2 tablespoons of hydrogen peroxide. He'll spew out liquid and frothy chocolate, so put him in the bathtub immediately after. Save your dog, save your carpet. Please take him to the vet also. The hydrogen peroxide is just in the event that you can't rush him in. During my emergency rotation 2 weeks ago, we were told by the attending vet that 30 milliliters, about 2 tablespoons of hydrogen peroxide is safe to administer orally in case of an emergency. I understand that there are contradictory opinions on this and not all vets may recommend it. Again, it's meant to be done in case of emergency. You should still take your dog to the vet. I'm not licensed to give medical advice, which I thought was clear when I said I was a vet student. Story 8. Former ER nurse here. I did DIY for a homeless patient. Generally, whenever we get a homeless person for medical treatment, as long as it's not life-threatening, we don't go out of our way to treat them. Especially if they are self-inflicted injuries to obtain pain meds. I had a guy come in for severe constipation. He hasn't had a bowel movement in a month due to substance abuse. We gave him laxatives and told him to drink lots of water and told him to be on his way. He kept on begging for help and refusing to leave without some treatment. It was a slow night and didn't want to have a scene, so I told the charge nurse I'll take care of it if it was okay, and to ignore the medical items charges. She was cool with it since he was in actual pain given how stiff and distended his abdomen was. So I took a urinary catheter and a 50cc syringe to the bathroom with him, filled the sink with water, had him strip down, some lube, and up with the catheter. Took a good 20 flushes for him to finally have a bowel movement. He went from looking like he had 4 turkey dinners to a skinny featherweight. The one thing I loved about working in the ER was, many times, it does come down to DIY for things we don't have a procedure for. Everyone might be wondering why I didn't use an enema kit. We didn't have them, and the squeeze bottle kind would have been dangerous. Plus, the catheter, syringe, and lube was cheap, and the charge nurse was okay with ignoring the laws. A gravity enema wouldn't have worked on him since his impacted stool was so bad the tube would have just been blocked. The syringe was needed to force the water inside and around the stool to get things started. It worked mainly because the 50cc syringe and the catheter fit pretty nicely. Okay, that's unexpectedly wholesome, but not so wholesome if you see it in your brain, unfortunately. But hey, I'm glad this person was there to help him out. Story 9. I met a guy that only did his own wound care. He hired this guy, who has no medical experience, to be his help or personal care worker, and then directed him to do stuff. That poor guy. So, in wound care, we use sterile gauze and we have specialized products that can soak up more than average amounts of fluid. We even have specialized iodine products that can help prevent bacterial growth. This guy just used regular gauze products and then used some special tape he found to cover everything. He found some odd foam that he would put on top of his wounds. It was a coccyx wound to his back. His wound was generally extremely gross. He asked me to help, and I was like, I can't do that because it's so wild. So we made him sign something that he understood the risks of completing his own care. To be fair, knowing what I know now, hospital nurses sometimes suck at wound care, and I think specialized home care nursing would have been more beneficial since he was interested in taking care of his own health. I think in hospital, his wound got worse, hence his distrust of medical people in general. Medical people are not always nice when their advice is not taken, so it creates a really frustrating situation, with patients' health often on the line. Luckily, or unluckily, he liked me, so I was able to convince him to listen to people. Oh yeah, and this guy had his own rubber catheter that he made with some rubber hose. It actually worked pretty well, in my opinion, because it just sort of clasped his junk. Usually they're loose, and we wrap something like tape to let it breathe and not get contaminated. It was gross anyway, so maybe it didn't matter. Eventually, it was determined he had a clot to one of his legs and he needed an upper knee amputation. Surgeons are sometimes jerks, and this one clearly made his decision reviewing the notes, and his assessment was brief. The patient was furious at this until an internist came around and listened to him. Then the internist calmly and firmly stated the reasons why he needs a surgery and that, quote, I am confident you're an independent guy and you'll get through this. Then the patient, amazingly, agreed. So I never saw him after that. It was a good lesson that sometimes people are wild, crazy, and odd, but if you flip it around as a clinician and treat them with respect, work with them, you can make your life a little bit easier. Story 10. I've been a registered nurse for almost 8 years, and I've seen it all. You'd be amazed at how much we see and hear people do to themselves and then so easily forget. A couple of DIY remedies stick out in my mind, though. I currently work on a renal and pulmonary, kidneys, and lungs intermediate care floor. We had a patient recently who had chronic kidney disease and was getting close to needing dialysis. She had a ton of problems while she was in the hospital with us, but one of the issues the docs unearthed was that she had a giant blockage in her bowels that was literally causing her to spew it up because the stool couldn't pass by the blockage. The family finally thought it was wise to let us know that they bought some kind of healing clay powder on Etsy. It was supposed to cure her kidney issues, and they had been feeding it to their mom. The clay ended up clumping together in her bowels and causing this obstruction. Earlier in my career, another elderly patient had been having issues with panic attacks, but she noticed that if she rubbed her neck in a certain spot, it would get better. Turns out she was frequently going in SVT and was essentially giving herself a carotid massage, which made her feel better. The anxious feeling she was having was from her heart beating so fast. Crazy coincidence, I guess. I don't know how she came about this herself, though. Another treatment that I'm sure many people have heard of had a very obese and yeasty lady as a patient, who we found out has been trying to cure her horrible yeast infection with Yoplait and tampons. She ended up on IV Diflucan. It was so bad. Story 11. So a lady comes into the ER and refuses to tell the triage what's wrong other than to say she had something growing down there. She wants a lady doctor, and that's that. So we get her set up for a pelvic exam in one of the OB-GYN rooms and call the only female physician working that night to come check her out. The doctor is in the room for maybe 2 or 3 minutes before she comes out, with a stench that made everyone in the vicinity gag, wafting from the room behind her. The patient is around 50 to 55, a previous substance dependent, about 10 or 11 children, no medical insurance, pre-Obamacare times. Her uterus had begun to prolapse, so with no money and no insurance, it was suggested she just put something up there to hold it in. Without much on hand that could both fit inside her and stay inside her without falling out, she came up with a genius plan: a potato. And what do potatoes like to do in a warm, dark, moist environment? Why, they like to grow. The something growing down there was the vine the potato shot out for sunlight. The potato had fully rooted as well, and the potato itself was deteriorating, hence the stench. She had to have a full hysterectomy. We nicknamed her Tater Twat, and she's infamous at this hospital. Okay, Tater Twat. Is it okay if I'm laughing or chuckling at that? It's also mean at the same time. Let me know what you think in the comments below. And if you like these stories, here's a few more. YouTube thinks you're going to love them. So I'll catch you there, and thank you for hanging out with me in this one.